A 30 years old aid worker becomes unwell whilst helping the scene of the recent earthquake. He develops vomiting and soon afterward diarrhea. That is loose and extremely watery. What is the most likely infective organism? Here the options are Campylobacter jejuni, Vibrio cholera, enterohemorrhagic E. coli, Clostridium perfringens, and Clostridium botulinum. So what is the organism responsible for this infection? That means a 30 years old man develop vomiting and diarrhea. That means it is the clinical feature of the acute water diarrhea, which is vomiting with diarrhea, and which is extremely watery, and this diarrhea is extremely watery. That means very loose stool. So it is the acute watery diarrhea. So we have to find out the cause or organism of the acute watery diarrhea. First of all, let's see the Vibrio cholerae. The Vibrio cholerae, it is a short gram-negative rod, and it is transmitted by contaminated water and seafood. And in this scenario here, we can see the patient is aid worker and helping the recent earthquakes. That means in case of the earthquake, there is a heavy pollution of the water and also the food. So what are the symptoms? Sudden onset of the vomiting and also profuse watery diarrhea. So vomiting and profuse watery diarrhea, these two is diagnostic tool for acute watery diarrhea. And what are the treatment option of this Vibrio cholerae, the acute watery diarrhea? Vibrio cholerae, it causes acute watery diarrhea. So what are the treatment option? Treatment option is the rehydration and give supplement fluid and electrolyte, which is lost through this acute watery diarrhea. And most cases will resolve. Antibiotic is generally not required. So antibiotic is usually not required in case of the acute watery diarrhea. So we have to correct dehydration, we have to correct the electrolyte imbalance. It is enough to treat the Vibrio cholera. So the passage of very loose and watery stool, it is distinguishing from the other diarrhea. So most gastroenteritis infection does not produce such watery motion. That means the watery portion, they are mainly produced by the Vibrio cholera. So what is our answer? Our answer is the Vibrio cholera. Other options here presents and the point. First of all, let's see the point in favor of the Vibrio cholera. This is the vomiting, it is the first point. Second one, it is the very watery diarrhea. And third one, there is pollution by the earthquake, and after earthquake there is pollution of the water and pollution of the food. Other option here, such as the Campylobacter jejuni, it may cause the dysentery. The enterohemorrhagic E. coli, it also called the diarrhea but bloody diarrhea. Clostridium perfringens, it causes gas gangrene. Clostridium botulinum, it also causes GIT upset when a person taking bottle food. That means the food usually preserved in the bottle and they are infected. So our answer is the Vibrio cholerae.